Hello and welcome to Thirsties Live. My name is Laura. I'm Thirsties social media coordinator, and usually we are talking about diapers on Thirsties Live or some kind of eco-friendly, sustainable living type topic. But I don't know if you noticed the red. We are talking today about heart health and awareness, specifically congenital heart defects, how they impact families, and how we as a community can support these children and these families. Now, a lot of the things that I'm going to say, a lot of the things that are helpful are actually could apply to families that have chronically ill children. Or I know coming up, one of our Thirsties Groupies told me that this, I think February 29th is actually National Rare Disease Day. And so a lot of these, if you know someone who has a child who is chronically ill, who has significant health needs, a lot of these tips and just insights is going to also apply to them. But since it's February, we're going to focus on heart health. And the most common heart condition for children is congenital heart defects. And what that means is it's basically some kind of anomaly in the structure of a child's heart. Usually this is diagnosed either in an ultrasound while baby is in utero or shortly after birth. And depending on how critical the defect is, it usually means some kind of surgery or multiple surgeries, probably within the first year of this child's life. So this is, hello again, someone who was watching me over on Instagram is saying hi here. Hi! So instead of me just telling you about it, I actually interviewed one of our Thirsties Groupies. Her name is Donna, and she has a precious little daughter named Jubilee who was actually diagnosed with a heart defect while in utero. So what happened was Jubilee has a heart defect, and also she has Down syndrome. And so Donna was actually induced at 31 weeks. This was a choice that her doctors made just for the health of Jubilee. And so when Jubilee was born, she was whisked right off to the NICU. And I believe she was a month old before Donna was able to actually hold her baby. And now the NICU reality is definitely something we could talk about on Thirsties Live. I think that's a whole nother broadcast. Let's just give a shout out to families that have babies in the NICU and those NICU nurses and doctors. They do fantastic work. We're going to continue to go on with Jubilee's story and focus on the heart health aspect of it. So after a long stay in the NICU, Jubilee was sent home on oxygen, and Donna was telling me that before her open heart surgery, Jubilee didn't really cry much, actually didn't really cry at all like a healthy baby would. Was really, really sleepy. And so they were just on a rigorous schedule of every 3 hours needing to wake Jubilee up, often using like wet washcloths to keep her awake so that she could eat. And it usually took her an hour to get what she needed on each feeding. So they were feeding her around the clock. Donna was saying, I had like tubes and medical equipment all over my house. One of the things that really struck me when she was telling her story was the pulse ox alarms that would come off. This was measuring like the oxygen in Jubilee's blood. And Donna was saying that she still hears like those phantom beeps and alarms, even though Jubilee is fine. Let's fast forward. Jubilee's okay. She had open heart surgery when she was 3 months old, and now she's 3 or just over 3. But Jubilee's okay. Um, but still, just early life for her looked very, very different. So lots of long trips to the doctor's office. Donna was saying that just her life was, it was just exhausting, and she was saying, I don't remember a whole lot about that, those first couple months before her surgery, because it was such a blur. um, so Jubilee has her open heart surgery, and then after her surgery, Donna was saying, I had a completely new kid. She would cry when she needed something, which actually Donna was like, it actually freaked me out because Jubilee never cried before, and now she like would cry when she needed something. And so Donna had, her and her husband had to kind of relearn what was normal for their kid. Um, and so now, Jubilee, she still has to lots of visits with her cardiologist. um, but she's okay. But this is going to be just a reality that their family just lives with. And that, I asked Donna, what are some things that you want families to know about your life with a child that has a heart condition? And again, I think this is probably true for just even chronically ill kids. um, Donna said the first thing is just to know that her kid is always going to be different in some ways, and things are going to impact her family differently than it might families with healthy kids. So for example, Donna was saying, while your kid might get a cold and feel bad for a couple of days and then be fine, what that could mean for my kid is a 2-week hospital stay. And this was actually really eye-opening for me. So she was saying, if you're on the fence about whether to take your kid to the play date or, just out in the open, realize, don't just think about their health, but think about like the other kids that they might impact, which I had no idea that, a cold for a child that's had open heart surgery, a cold could become really, really serious for them. So that's just something just to be mindful of, especially in this flu and cold season anyway, right? So there's that. Another thing that Donna said she wanted families to know is that unsolicited advice is never helpful. And a lot of people, when they're trying to be supportive or trying to engage with her about her daughter, that often they'll give unsolicited advice, and rather than doing that, what's more helpful and what communicates you care in a more positive way is just by asking questions, or just even being present with them, listening, and listening without having to share advice. I also talked with my friend who, he is actually a doctor. He's a cardiovascular disease fellow at St. Luke's Mid-American Heart Institute, and I was asking him kind of his perspective on what would be helpful for these families, and here's what he said. Congenital heart disease is really tough on families and their patients. In the acute setting, these families, they worry about their child surviving, and this usually leads to very involved parents who care strongly about their child. So all that to say, these parents, they probably know the ins and outs of their kids' health. They don't necessarily need your advice. They just need your presence. Going on, Chris says, helping those with heart disease in this acute setting can be very tough. The time commitment for parents is huge. Anything that helps parents focus on their child and their health issues is extremely helpful. That could mean making meals, taking care of or giving rides to their other children, things like that. And this was actually something that Donna also said what that was really helpful is doing things. It was really helpful for her and her family, especially in those early days in the NICU and then also at home, doing things that would allow them to sleep, coming and taking, shifts feeding Jubilee at night so that her and her husband could rest. Or another thing Donna said was, when your kid is sick like this, it becomes your life. And so, kind of normal life, laundry, cleaning, meals, all of those tasks just become super daunting. So, just a practical thing could be making meals, coming and doing laundry. Another thing Donna said was really, really helpful is when her friends and family would understand that her and her family are doing the best they can, but they always have to prioritize their kids' health over, like, maybe coming to your party or, doing this or doing that. Like, those first early months for Donna, she was just so worried about Jubilee getting sick. And so they really couldn't do the things that they would normally do. And their family was really, really understanding of that. And that was really, really helpful for her. Going on, Dr. DeZorzi says, as these families move forward from original diagnosis and surgeries, the time commitment of the parents remains high, but most of the immediate help starts to disappear. So having in place something that isn't temporary would be huge. Maybe knowing that their older kid is always going to be picked up from school, or maybe knowing, once a week they're going to have help with this meal. So that could be another really helpful thing, is not just in the immediate situation when the kids are having surgery or treatment, but prolonged help, regular help, like a weekly laundry folding date, a weekly meal, things like that can really help these families. And then to end this talk, last but certainly not least, one of the things Donna was saying she wished people would know is that while children who have had open heart surgeries, they can go on, they can live healthy lives, their life is always going to be slightly different. And that is just acceptance of that, and recognizing that can be a really great way to support families. And we won't know what that different looks like. So don't assume what that different looks like. Ask if you want to help. Ask how. Or if there's something that you don't know, a lot of these parents, they are great at being not only advocates for their kids, but for other sick kids too. So show that you care by just having that conversation. And that's exactly why we are taking our break from talking cloth diapers to talk about heart health and how it impacts families. So we hope that this discussion has been helpful for you. If it has, please feel free to share this, and hopefully you learned something. If you have questions, feel free to put them in the comments, and we will do our best to answer those questions, or at least to point you to resources where you can get answers. So thank you guys so much for being here on Thirsties Live. And we will see you next week when we talk about probably my favorite Thirsties newborn product. So you'll have to find out what that is. Well, we'll tell you before next Thursday. But if anyone's expecting a newborn, you're not going to want to miss next week's live. We will see you guys.